And so I look at this, and part of the reason we ended up talking about all of this was because there's this disease going around called COVID. I'm sure you've heard of it. And
Right.
I periodically see people on television, on ventilators, who say, I don't trust the vaccine. And I see them on the ventilator, which you pretty much, you and your friends and your colleagues, made part of standard medical procedure. And I'm asking myself, so Professor Roussos, in some sense, you discovered the basic science around ventilators and lungs, and you did the clinical work, and you helped establish a whole bunch of hospitals in intensive care medicine. You're on the John Hopkins, I believe you work with John Hopkins these days, and the Stavros Niarchos Foundations. I don't even know how many hospitals you've built. So when it comes to intensive care medicine, this is kind of your life's work. And if somebody were to come to you and say, hey, COVID, what should I do? What would you say? Trust my intensive care medicine or take the vaccine?
Well, I hope that these questions will not be asked by my son.
No,
because
triple boosted.
I think that you're a little bit clever. But my God, this question is the silliest question that somebody can ask. The point is to avoid the patient to come to intensive care. And there is only one way in this kind of disease: vaccination, period. Even if there are some side effects, well, every medication has some side effects. If you want to become panic, read what aspirin, for example, can do to you, and you will say, "Oh my God, I'm not going to take aspirin anymore." But I mean, everything, medicine is from the Greek word, which is pharmako, means poison as well. So we take the good part of this poison and we help the patients. And we do our best, and I think medicine today has made such a progress that my God, I mean, you don't have side effects basically from most of the drugs that we are using today. And if there are some minor effects, peanuts, nothing. So vaccination to avoid the patient to come to respirator.
The best way to avoid dying in an intensive care unit, if I'm hearing correctly, is to never get to an intensive care unit. Is that fair?
That's correct. And let me tell you, maybe people don't know. They think that we can solve the problem with the respirators, but they don't know the rate of mortality that we have in the best ICUs in the world right now. For example, I believe my previous ICU in Montreal is the best in the world. The death rate there is 42-45% for the COVID patients. In other ICUs, it is 70%. In other, it is 80%. And at the beginning, in some, like, I don't want to name the states, etc., they had almost 95%. So it is a miracle, but not really a panacea, the respirator.
And let me ask you a question, right? And the other problem is, and if I followed you correctly, is that, wait a second, if all these people have COVID on the respirators, then the people who have heart attacks start to die, right?
Yeah.
Because there's no beds.
Well, now you're asking another question. Right now, Greece is plagued by this problem. Unfortunately, we do have a lot of unvaccinated.
Mm-hmm.
And 90%, 95% of the patients that we have in the hospital right now are unvaccinated. And they occupy they occupy regular beds, and of course, the ICUs. But they are unvaccinated. And the problem is that other patients, like patients with myocardial infarct, trauma, cancer, etc., they do need operation or therapy. We do not have beds in order to treat them, because
So you would say
the beds are occupied by these non-vaccinated patients.
So you would say, if you were going to say something, if you care about your fellow human being, the right thing to do is to go get yourself vaccinated, so that somebody else who might have a heart attack doesn't end up can get treated so they don't die. Is that you would say that?
Yeah, absolutely.
It's like an obligation towards our fellow human being.
Absolutely, it is an obligation, and you know, when you were a child, I used to advise you for something. For example, don't cross the road once, twice, 3 times, 5 times, 6 times, 10 times, 15 times. Well, in the 15th time, well, do you think that I have other options other than spanking you?
Right.
And in fact, that happened to your sister, and then your sister became careful because had this bad habit, and mom spanked her, and then since then Katerina was fine. In other words, I mean, I don't. Rarely you will find people so much that believe so much in democracy, etc. But democracy is a system where you are not allowed to do things that harm your fellow citizen. And if you are not vaccinated, you do harm to your fellow citizen. And that's what they do. Not only they die, not only they suffer, not only they cost so much money to the system, but they do make harm. They damage the other people.
Okay, so thank you, and we'll probably do this again.
Well, okay, all right, but be careful. Don't ask me silly questions. Okay. I mean, between vaccination and respirators, I mean, this is a colossal mistake. Yep. Unless you were rhetoric, as you like to do that, and you ask these questions for that reason.